Hey, so today I want to talk to you about this drug, Concerta, which is a psychiatric drug given to children as young as 6 in the UK, as well as adults, to treat quote-unquote ADHD, attention deficit hyperactivity disorder. Make what you will of it. The point is the actual product in the drug is methylphenidate hydrochloride, which is a sort of amphetamine. So this is given to children as young as 6. I believe that in the US, you do have drugs such as Adderall, which is very similar, and it's actually given to children as young as 6 months old. Can you imagine that? That you got a hyperactive baby, quote unquote. I mean, shouldn't children and babies be alive and, you know, jolly and running around? But it seems that this is apparently a problem. So we have to they have to be quietened down into some little zombies. But what's very important here is this is 19 pages. This is a data sheet of 19 pages with side effects and quite horrendous descriptions, actually, to be honest. So I'm going to just read you a couple of bits there. I've highlighted it because obviously there's 19 pages, but I want to make some point. You can download this off the internet. Just type Concerta safety data sheet and it should come, or it should come up on the results. So Concerta is indicated for the treatment of ADHD. It says a diagnosis of ADHD implies the presence of hyperactive, impulsive or inattentive symptoms that caused impairment and were present before age 7 years old. Make what you will of it. You can download the DSM manual. I did that other video. You can download the DSM and you can read all this for yourself and you can make up your own mind. Now, interestingly enough here, long-term use. The effectiveness of Concerta for long-term use has not been systematically evaluated in controlled trials. And yet you have people who are on that drugs for years. Those children 6 years of age and above and adolescents. So it gives here all sorts of instruction on how you dose this drug. Again, it'd be very interesting to know if anybody watching this video has got Concerta prescribed to children younger than 6, just out of curiosity. As I said, I know in the US, similar drugs are prescribed to children younger than 6 years old. So here we go. Long-term, more than 12 months use in children and adolescents. The safety and efficacy of long-term use of methylphenidate has not been systematically evaluated in controlled trials. Use of Concerta in patients under 6 years of age has not been studied in controlled trials. And then you have a whole list, it goes on for pages and pages about problems that can occur. Potential for gastrointestinal obstruction, sudden death, hypertension. It goes on and on. Even priapism, prolonged and painful erections requiring immediate medical attention. Cerebrovascular disorders, aggression, anxiety and agitation. Use in children. The safety and efficacy of Concerta in children under 6 years old have not been established. Oh, and listen to this. This is a cracking one. The safety of methylphenidate for use during human pregnancy has not been established, and no studies are available on the use of Concerta in pregnant women. There is a limited amount of data from the use of methylphenidate in pregnant women. But then the next section says breastfeeding. Methylphenidate has been detected in human milk. So women are on that drugs whilst also being pregnant and feeding their babies. And it goes on, undesirable effects, and you have table of side effects. And some of them are actually really, really shocking. From, you know, gastrointestinal disorders, eye disorders, cardiac disorders, ear disorders, nervous system disorders, headache, dizziness, tremor. It goes on and on and on. Psychiatric disorders, insomnia, anxiety, initial insomnia, depression, restlessness, agitation, nervousness. Wow. And that's the side effect of the drug. So all I'm informing you of here is if you are considering taking that drug, because at the moment in the UK there is a massive trend of diagnosing quote unquote adults with ADHD and sticking them on drugs. So for your information, be aware, download the data sheet, inform yourself. Obviously, it's full of complicated words, so you need to use a dictionary, because I'm a big user of dictionary, as you know, for those people who've been following my videos. Don't guess what the words mean. Take a dictionary, look up what the words mean. Every word that you don't understand, just look them up. If you can't find them in a normal dictionary, you'll have to go online, but look them up and make sure you really, really understand what's written. And if you're a parent considering giving that to your children, then I would really recommend that you fully inform yourself and then decide, is it the right thing to hook your child on such medication? Because don't forget that this can be a lifelong hooking on drugs. And obviously, I'm not a doctor, so don't forget that, as it mentions it in here actually, getting off the drug can be very difficult and very problematic. So that's something that you would really need to go and consult with a good doctor, a good GP, you know, a truly helpful GP who would want to help you to get off of it, because there are some horrendous side effects to it. So it has to be done in quite a controlled fashion. But here you go, inform yourself. You can actually do the same with drugs like Adderall, every psychiatric drugs. You can go online and you can download the safety data sheets that should be available. So I would really recommend that you do that before you may make a decision that will be catastrophic for the rest of your life.